They never told you this, did they? That even in your 60s or 70s, your body still holds quiet wisdom, still yearns for connection, still aches for touch, not just from another person, but from yourself. And yet, many women your age have no idea that a simple act of self-care, one you may have practiced for decades, could shift silently in meaning and impact as you age. I'm Dr. Lisa Perriera. For over 30 years, I've helped women navigate the natural changes that come with time, physically, emotionally, intimately. And today I want to talk to you about something few doctors dare to discuss openly: how your relationship with your own body, particularly through self-touch, evolves after 60. Not to scare you, not to shame you, but to gently offer clarity, connection, and comfort. You've been told for years that masturbation is healthy, natural, nothing to be ashamed of. And that's still true. But what no one ever explained is this: how you engage with your body after 60 matters more than ever. Because without the right awareness, something that once brought you calm pleasure, even confidence, could slowly begin to create the opposite. So today, I'm going to walk you through 5 essential truths about self-pleasure in later life, truths every woman over 60 deserves to hear. These are not gimmicks or taboo confessions. These are evidence-based insights that can help you preserve sensitivity, support your pelvic health, and feel reconnected to the part of yourself that may have gone quiet over the years. And by the end of this video, I promise you'll walk away not only with more knowledge, but with more compassion for yourself, your changing body, and your journey. Before we dive in, please take a moment to like, subscribe, and comment below if any part of this resonates with you. These conversations are still rare, and your voice might be the one that helps another woman feel seen. Let's begin with the first truth. Secret number 1. Arousal isn't the whole story, and that's perfectly normal. A few months ago, a woman named June sat across from me during a routine visit. She was 74, sharp-witted, kind-eyed, and visibly uneasy. She leaned forward and asked Dr. Perriera, "Why can't I feel like I used to? Does this mean I'm broken?" That question, I hear it more than you'd think. And it breaks my heart every time. Because here's what I told June, and what I want to tell you now: you're not broken. You're evolving. You see, as women age, the biological patterns that once governed arousal begin to shift. Blood flow becomes more gradual. Estrogen levels decline. The nerves responsible for sensitivity take a bit longer to activate. What was once automatic now asks for intention, and that doesn't mean something's wrong. It just means the map has changed. Unfortunately, most of us were never taught this. We were raised to believe that arousal should be effortless, that wetness and intensity were the gold standards of womanhood. But that definition is narrow, outdated, and honestly harmful. The truth is, arousal is just one note in a much richer symphony, and it's completely normal for that note to sound different as you age. Maybe it's softer now. Maybe it takes longer. That's not a loss, it's a shift. I've worked with women who spent years thinking something was wrong because they no longer felt the same urgency or response they did in their 30s or 40s. They assumed their sexuality was over. What they didn't realize is that their bodies were asking for more patience, more presence, not less capacity for pleasure. And when those women stopped chasing a memory of their past and began honoring where they are now, something beautiful happened. Intimacy became deeper. Touch became more meaningful. And their confidence, which had quietly dimmed, began to return. This is the kind of emotional redefinition that matters. According to the North American Menopause Society, shifts in sexual response after menopause are normal and do not mean the end of a woman's sensual life. In fact, with proper attention and care, many women report a more satisfying connection with their body in later years, not less. So if you've noticed things changing, if you need more time, more intention, more warmth before pleasure arrives. Know this, it's not a sign of failure, it's a sign of growth. You're not falling apart, you're unfolding differently. And that brings us to our second truth. Because while we often think of masturbation as a purely physical act, the reality is far more profound. What if I told you that what's happening in your mind and heart matters just as much, maybe even more than what's happening in your body? Let's explore that together in secret number 2. Secret number 2. Self-touch isn't just physical, it's deeply emotional and neurological. A few weeks ago, I met a retired teacher named Brenda. She was in her late 70s, lively in conversation, but her voice lowered when she said, "I don't feel anything anymore, not just in my body, but anywhere." At first, she thought it was purely hormonal, maybe a circulation issue. But as we spoke more, it became clear what she was really describing was something deeper. A quiet, growing sense of disconnection from herself. Brenda had been masturbating nearly every night, but not out of desire. She did it out of routine, even a sense of duty. Somewhere along the way, that nightly habit had shifted. It wasn't bringing comfort anymore, it was just happening. And here's the insight that changed everything for her: masturbation, especially later in life, isn't just a physical release, it's an emotional language, a neurological signal, a conversation between your body and your brain. When you engage in self-pleasure mindfully, you stimulate more than nerves. You activate pathways in your brain that release powerful health-supportive chemicals like dopamine, linked to motivation serotonin, which stabilizes mood, and oxytocin, the bonding hormone. These chemicals don't just enhance your sense of intimacy, they help regulate sleep, reduce anxiety, and improve emotional resilience. Source: NIH, The Neurobiology of Sexual Behavior in Aging Women. But when the act becomes disconnected, when it's used only to numb, distract, or escape, it loses its restorative value. That's what had happened to Brenda. She wasn't doing anything wrong, but she wasn't present. She wasn't honoring the emotional side of her experience. So we worked together on rebuilding that connection. Small steps, soft music, breath awareness, moments of stillness before she began. Not to make the act more ritualistic, but to help her tune in again. And what followed wasn't just better sensation, it was a clearer mind, deeper sleep, and a surprising return of joy. Many women over 60 have spent a lifetime putting others first. You may have raised children, cared for partners, held households together. It's no wonder that your own needs, especially the quiet ones, often went unmet. And when those unmet emotional needs surface loneliness, sadness, restlessness, they sometimes show up in the only private space you've ever had your own body. But you deserve more than habit. You deserve intention. You deserve to feel like you're not just doing something to your body, but with it, with care, with kindness, with attention. Which leads us to the third truth, one that's often misunderstood and even feared. Because while some women may continue self-touch without presence, others may stop altogether thinking it's no longer necessary. But here's the truth. You need to hear, avoiding touch completely may be quietly harming your body in ways no one warned you about. Let's take a closer look. Secret number 3. Use it or lose it is real, but it's not what you think. Frances was 74 when she first came to see me. After years of being widowed, she'd started dating again, but rather than excitement, she felt embarrassment. "My body doesn't respond," she whispered. I thought I was ready, but now I feel broken. That word broken comes up far too often. But as we talked, it became clear that what Frances was experiencing wasn't permanent dysfunction. It was simply disuse. Here's what every woman over 60 should know. Your vaginal tissues, nerves, and blood vessels are like any other part of your body. They thrive with gentle, consistent attention. When you stop engaging with that part of yourself, changes begin to occur. Vaginal walls can thin, elasticity can fade, lubrication decreases. Nerve endings may become less responsive. This is called vaginal atrophy, and it's not just an aging issue, it's often an activity issue. According to the Mayo Clinic, vaginal atrophy affects nearly 50% of postmenopausal women, and one of the most effective ways to reduce symptoms beyond estrogen therapy is regular stimulation, either through intimacy or self-touch. But because many women like Frances were never told this, they assume their body is simply shutting down. In reality, it's simply going unused. The encouraging news that function can often be restored. With time, patience, and often a high-quality, unscented lubricant, your body can begin to reawaken. That's exactly what happened for Frances. Within weeks of exploring gentle, consistent self-touch, not with pressure but with presence, she noticed small but powerful changes. Warmth, sensation, a soft return of confidence. This isn't about chasing youth. It's about respecting biology. Your body still wants to be connected to. It still wants to work for you if you show it care. Unfortunately, there's another side to this coin that we need to talk about. Because while neglect can lead to decline, over-reliance on one very common tool can have hidden consequences as well. It's something I've seen more and more in recent years, and it's often invisible until one day you can't feel what you used to feel. Let's talk about it in secret number 4. Secret number 4. Your vibrator might be silencing your body's natural response. Barbara was 68 when she sat across from me, her expression equal parts confusion and sadness. "I still touch myself," she said, "but it feels flat, like my body isn't part of it anymore." Barbara, like many women her age, had turned to a high-powered vibrator years ago. It gave her the kind of quick, reliable release that seemed helpful, especially after a divorce and long periods of loneliness. But over time, something changed. The vibrator still worked, but nothing else did. What Barbara didn't know, and what many women never hear, is this: your nervous system, especially as it ages, becomes more sensitive to the type of stimulation you give it. And when that stimulation is high intensity and repetitive, your brain begins to adapt, to expect only that. Think of it this way: if you only ever listen to music with the volume turned all the way up, a whisper becomes almost impossible to hear. That's exactly what happens with strong, direct vibratory stimulation. Your body may grow so accustomed to that intense input that lighter, more subtle touch, whether from a partner or your own hands, feels dull or ineffective. This isn't about judgment. It's about neuroplasticity, your brain's ability to rewire itself in response to repeated input. And according to research published in the Journal of Sexual Medicine, repetitive use of high-intensity vibrators in older adults can reduce genital sensitivity over time, particularly when other forms of stimulation are absent. Barbara had unknowingly trained her body to respond to one thing only. And the emotional toll was profound. She felt disconnected from her own sensuality and increasingly unsure of how to enjoy intimacy without a device. But the story didn't end there. Together, we made a plan not to eliminate her vibrator completely, but to reduce its frequency, reintroduce slower touch, and invite more presence into her routine. She began with soft fabric, warm baths, breathwork. No expectations, just reconnection. Within a few weeks, something shifted. Barbara told me I felt my skin again. Not just the sensation, but the feeling of being alive in my own body. You see, this isn't about giving up pleasure. It's about broadening your body's capacity to feel fully and in many different ways. Vibrators can be wonderful tools, but they should support your connection, not replace it. So if you've been using a device that feels more mechanical than meaningful, don't be discouraged. Your body hasn't stopped working. It's just waiting for a different kind of invitation. One that's slower, softer, more attuned to the present moment. Which brings us to the final secret one that ties all the others together. Because after all the confusion, shame, and silence surrounding this topic, what's most important is not how you touch yourself, but why you still deserve to. Let's look at the most powerful truth of all. Secret number 5, self-pleasure can be a lifeline, not a liability. Georgia was 75, elegant and kind, and toward the end of a regular checkup, she hesitated. "Dr. Perriera," she whispered, "is it okay to still touch myself?" That question hit me like it always does not, because it's rare, but because of what it reveals, the weight of cultural silence, the shame so many women carry about their own bodies, even in the privacy of their own homes. And here's what I told Georgia, and what I want to tell you now. Yes, it is more than okay. At your age, it may be one of the most powerful acts of self-care you still have. Let's set aside the shame and look at the facts. Masturbation, especially after menopause, does more than provide release. It maintains blood flow to the pelvic region, which supports vaginal lubrication and tissue elasticity. It keeps nerves active and responsive. It helps prevent discomfort during intimacy. It even boosts immune function by reducing stress and promoting better sleep. But beyond the biology, there's something even more vital. It keeps you in touch with the part of yourself that still feels desire, identity, and vitality. After her husband passed, Georgia told me she had stopped everything, not just sex, but even small pleasures. "I thought that chapter of my life was closed," she said, "that I wasn't supposed to want any more." But when we began to explore that belief gently, she realized the truth. Desire doesn't disappear. It only softens. It waits patiently for your attention, and if ignored too long, it becomes loneliness. When Georgia gave herself permission to reconnect slowly on her own terms, she didn't just feel physical changes. She slept better. Her mood lifted. She smiled more. Not because she was chasing her younger self, but because she was reclaiming her right to feel like a whole woman again. And you have that right too. You've spent decades giving. You've walked through transitions, grief, menopause, reinvention. You don't need to apologize for wanting to feel alive in your own body. Not now. Not ever. The real secret is this. Your sexuality doesn't expire. It evolves. And when you allow yourself to meet it where it is not where it used to be, you unlock a new kind of power. One grounded in wisdom, gentleness, and the courage to stay connected to yourself. Coming up in part 4, I'll share a few closing reflections, what these truths mean for your health moving forward, and how you can use this knowledge to guide your next chapter with grace, curiosity, and joy. If you've made it this far, I want to thank you, not just for your time, but for your openness, for daring to explore a part of your health that for too long has been wrapped in silence. Because what we've discussed together, these 5 quiet truths about your body, your pleasure, and your connection to self, isn't just about sexuality. It's about dignity, about honoring the full woman you still are, regardless of your age. Let's briefly revisit what we've uncovered. First, we talked about how your arousal may shift after 60, and that this change is not a loss, but a natural evolution. Your body asks for more presence, now, more warmth, more intention. And when you give that to yourself, something beautiful opens up. Then we looked at how self-pleasure is as much emotional and neurological as it is physical. It's not just about release, it's about grounding, emotional regulation, reconnection. Your body speaks not only through sensation, but through its longing for calm, safety, and attention. We then explored the often misunderstood idea that use it or lose it is real not as a threat, but as an invitation. With regular, gentle stimulation, you can maintain tissue health circulation and even confidence. Neglect doesn't mean you're broken, it just means your body is waiting to be remembered. From there, we addressed the quiet cost of over-relying on intense tools like vibrators. Not because they're bad, but because they can limit your ability to feel subtler, more meaningful touch. When you invite variety, slowness, and awareness, your body can start to respond in new, often richer ways. And finally, we arrived at the most essential truth. This act done with care and respect is not shameful. It's sustaining. At your age, self-touch isn't a luxury. It can be a lifeline, a ritual that reminds you that you're still here, still feeling, still worthy of comfort and connection. Now I want to leave you with something I tell every patient who's ever hesitated to speak up about this part of life. Your story doesn't end because you turned 60 or 70 or 85. Your desire to feel joy, to feel sensual, to feel yourself that doesn't expire. It transforms. And when you approach your body with curiosity rather than criticism, with compassion rather than comparison, you find something far more valuable than performance, you find presence. Aging doesn't mean letting go of who you are. It means reclaiming the parts of you that still whisper, still glow, still want to be touched, not just physically, but emotionally, spiritually, completely. This is about more than just anatomy. It's about agency. The freedom to explore your body, not as something to fix, but as something to honor. So here's what I hope you remember. You are not too old. You are not too late. And you are not alone. There are women all over the world, women just like you, quietly waking up to the truth that self-pleasure at this stage in life is not something to hide. It is something to celebrate, with softness, with grace, with no apologies. And if this message touched something in you today, let that be the beginning of listening to yourself more deeply, the beginning of letting go of outdated rules, the beginning of asking your body what it needs without shame, without fear. Because you, dear friend, still matter. And your pleasure, your peace, your presence are still worth tending to. Now I'd love to hear from you. Which of these 5 truths resonated most with you? Please feel free to share in the comments. Your story might just be the spark that helps another woman feel less alone. And if you're ready to keep learning, growing, and reclaiming your health with clarity and compassion, I invite you to subscribe to this channel. We share thoughtful, medically sound guidance made especially for women navigating life after 60 with dignity and warmth. And if someone you love, a friend, a sister, a mother, needs to hear this message, please pass it along. You never know what a gentle truth can awaken. Let's keep breaking the silence together, because you deserve the truth. You deserve support. And most of all, you deserve to feel fully alive in every chapter of your life,